Hi there, everyone. Happy Friday. I'm Rendi Murphree, epidemiologist and director of disease control at the Mobile County Health Department. We're here to give you our Friday Facebook Live update on the effect of the COVID-19 pandemic on Mobile County. So we'll just start a little bit like we always do with worldwide numbers. So worldwide, over 17 million cases of COVID-19 with nearly 675,000 deaths worldwide. In the U.S., we're nearing worldwide numbers, so worldwide over 17 million cases of COVID-19. So in the United States, we're approaching 4.5 million cases of COVID-19 with just over 150,000 deaths. And in Alabama, just over 85,000 cases with 1,531 deaths. The Mobile County Health Department report today that is produced in conjunction with SSI Group reports on 8,190 cases of COVID-19. 243 cases were added just yesterday. That is our second highest number of cases added in one day. On Thursday, the number was 206. On Wednesday, 193. So we are seeing this pattern that we have seen throughout the outbreak where we have lower numbers reported to us on the weekend, on Monday and Tuesday, because less testing is occurring on the weekend. And then as the week goes by, we see a steady increase in the number of cases reported. And again, we were hoping that we were starting to see maybe a little bit of a plateau, but only we'll have to wait a couple of more days to see if that will actually come to fruition. It's not looking good. So again, the second highest number of COVID-19 cases reported yesterday, 243. We also saw an increase in the number of patients who have died with COVID illness. We're reporting 194. That's an increase of 4. I want to mention we will still be producing this report daily. Monday, it will contain information on hospitalizations, and that data comes from the AIMS system, the Alabama Incident Management System. So look Monday for the Monday through Friday report to include the information on hospitalizations again. And then our Monday expanded report where we report on things like the percent positive laboratory tests, report on demographics of those who have hospitalized and died, look at trends by week and month and moving averages and all of those things. We are still going to produce that report weekly, but starting Monday, it will come a little bit later in the day. We're trying to give our staff that had been working every Sunday to produce that report a little bit of a break so that we can do that report on Monday and have it out to you still on Monday, just a little bit later in the day. So some important things that have happened this week. You probably are aware that the governor and the state health officer announced an extension of the amended Safer at Home order through August 31st at 5 p.m. This basically extends all of the requirements that have been, or the guidance that has been placed under the order, everything extended. And again, that includes mandatory mask wearing in schools and colleges where possible for employees and students in second grade and above. So the age was lowered, so it's second grade and above shall wear a mask. In public places, any place that 6 foot physical distance cannot be maintained. And remember that wearing a face covering is sort of an additional layer to protecting yourself from COVID transmission. We still need you to do things that we have been messaging from way back in March and April. Wash your hands frequently, cover your cough, stay at home if you're sick, stay at least 6 feet distant, put at least 6 feet distance from you and anyone who doesn't live in your immediate household, which means if they don't sleep under your same roof at night, stay 6 feet away from them and wear your face covering to protect yourself and others. All right, on Friday, we usually report the number of complaints we have received. It has gone down a little bit. I think the statewide, mandate for face covering and many large national chains of restaurants and grocery stores and big box chains have implemented mask requirements upon entry has really helped compliance with that mask order. So last week there were a total of 15 complaints. The overwhelming majority of those, something like 75%, were food establishments. So the total for July, we fielded 138 complaints of violation of the Safer at Home order. In addition to those 138 that were permitted establishments, this week we've also responded to 30 complaints of establishments around the county that are not permitted. So these are things like churches or workplaces or salons, that sort of thing, where people have been concerned where the Safer at Home order is not being adhered to, and they let us know about it, and we call the owner or the manager and try to educate and inform them, make sure they understand the what is included in this Safer at Home order, and that they understand that and are applying that. All right, on to some questions. We didn't have too many this week. Someone asking if I can address how an outbreak in a treatment facility, a mental health facility, should be handled. And a congregate setting an outbreak in a congregate setting is always handled the same way, whether it's a hospital or a mental health hospital or a treatment recovery center or a group home or a shelter or a detention center. Outbreaks of COVID in congregate settings are handled the same way. We go in and we work with the facilities to make sure that they test all of their staff and all of their residents so that they know how much COVID is in their facility, and then help them make decisions about cohorting the positives. So if you have positive residents and staff, they need to isolate, but we just want to make sure that if they cannot be discharged from this facility to be released home to isolate, if they must be isolated in the facility, then we try to help the facility identify a COVID unit where all of the people who have COVID can be isolated together to reduce the number of staff that have to care for them. And then anyone who's exposed to cases in a congregate setting must be quarantined at home for 14 days. So if you have a COVID positive, you're at home for 10 days or isolated for 10 days in the congregate residence, if that is your resident. And if you're exposed to COVID, you need to go home for 14 days. And remember, there is no longer a recommendation to test for COVID for returning to work or returning to school. Once you have served your time, you can go about your normal activities. Just remember that you still need to maintain 6-foot distance and wear a face covering and wash your hands. All right, here's something from Fox asking that the Alabama Hospital Association is reporting that ICU space in Alabama is down to around 12% for COVID and non-COVID patients. How are Mobile hospitals doing? So all of the hospitals are maintaining capacity, so they have some capacity, but staffing is an issue. We know that healthcare workers who are frequently exposed to COVID positive patients and then also exposed when they're out in the community often have to go home for quarantine. And when that happens, it makes it very difficult to keep all of the open beds staffed. So we know that they are working hard to keep their staff at as close to 100% as they can so that they can keep those beds open. They are, however, doing things like maybe opening other rooms, maybe opening ICU beds in other parts of the hospital if they need to. But right now we're hearing from the hospitals that they are stressed, but they are coping. So we are very thankful for that. Asking about the percentage of available ICU beds. I don't know that number. I've not looked at Ames lately. And again, it's rather difficult to tell now because they're opening up ICU beds in other parts of the hospital as they need them. So that number changes on several times throughout the day. So it's a little bit hard. But again, speaking to the chief medical officers and the chief executive officers this week, our executive team feels like the hospitals are faring well, though they are stressed. So do what you can to maybe postpone a non-essential procedure to try to give them some breathers if you want to, but they are saying that they're full, that they're available, they're open, they're taking people, they're not thinking about putting anyone, like canceling elective surgeries. Okay. again, Fox 10 going on about space for ICU beds. So far, Tyler, we're doing okay. All right, another question from the media about cases not going down much. Me wondering about the mandatory mask ordinance, if it's working. Well, we're just now getting to the point where I think we'll be able to tell. You know, when the city ordinance was implemented, there wasn't a lot of compliance with that ordinance. It was mixed. Some people really followed it, and then we know that lots of people did not. So we knew early on that the health officer ordinance and the city council's ordinance might have a limited effect because it wasn't a comprehensive ordinance for our entire county. And there weren't a lot of people, just by anecdotally being out and about, who were complying with it. Well, since the governor's order has gone into effect, we hear that there is a lot more compliance. And now, as I said, the corporate big box chains are getting on board. And that was just 2 weeks ago. So we hope that we will begin seeing the effect of that mask mandate. But again, it still depends on compliance. So just issuing the mandate is not going to make the number of cases go down. The number of cases have continued to rise, though it looks like this week it may be only about the same as last week. What we have seen trending the last 4 weeks is a steady decline in the percent positive laboratory tests. So about 4 weeks ago, our percent positive laboratory tests jumped up again around the low 20s, 20, 21, 21 and a half, which was similar to percent positive way back in April, and that has gone down slightly but steady for the past 4 weeks. So we hope that trend will continue, and that may be an early sign that the mask ordinance is working. It's too early to tell if the mask ordinance is helping to reduce the number of hospitalizations and reduce the number of deaths, because again, those are lag indicators, and we don't find out about hospitalizations and deaths, or they don't even occur until longer in the duration of someone's course of illness. So it will take some time before we see if it has an effect on that. The other thing about hospitalizations and deaths going up is we know that we have outbreaks in nursing homes, long-term care facilities, senior living facilities, those types of places. We have about 8 or 10 of those that are experiencing low numbers of COVID positive, and a couple of them with a rather large number of residents and patient and staff that are COVID positive. So that we know will drive the hospitalization and death numbers up, just like it did in the beginning of our outbreak back in March and April. So we'll keep a close eye on that. Okay, someone also asking me about the Bama Tracker website, which I don't know who runs that. I don't know where their data comes from. So I really can't say a whole lot about what is presented on the Bama Tracker website, but they are reporting on a real-time reproductive number. So it's called RT, real-time reproductive rate. And I think on the 29th, the reproductive rate was slightly less than 1. And so implying that we had less transmission going on than the day before, but the day before was only 1.01. So these minor fluctuations above and below 1 really are not meaningful. So what we want to look at and what we continue to focus on are sort of 7-day and 14-day trends. If we start to see a 7 or 14-day reduction in the number of that reproductive rate, then we will be very excited about that, but it's just too early to tell. And again, remember that sort of minor changes above and below the number 1 are often meaningless. All right, someone asking about people on social media and sometimes in the news media and print media comparing COVID with influenza. And we do have data on deaths, on pediatric deaths and influenza death of any age to compare to year over year. And yes, we expect every year to see hospitalizations and deaths related to flu, but flu and coronavirus are very different viruses. Yes, they both cause respiratory infection. There are a whole host of other viruses that also cause respiratory infection, but flu does not cause the acute respiratory distress syndrome that is associated with COVID. So this situation where you get to where you just cannot, you don't have enough oxygen in your blood to maintain your organ systems and those sorts of things. And that is totally different from what causes people to get hospitalized and die from influenza. For influenza, it's mostly pneumonia associated hospitalizations and deaths. So yes, on the surface, they're both viruses. They both make you cough and give you a fever, but they are very different, and we need to not make too many comparisons between what happens with COVID and the flu. All right. So last from Facebook, am I suggesting people no longer need to be tested when they develop COVID symptoms? So this is a little bit tricky. I think that if you know that you have been exposed to someone who was diagnosed with COVID, and then you get sick within 14 days, no, you don't need a test for us to know that you're COVID positive. If someone living in your household tests positive for COVID and you're quarantining at home and you become sick within 14 days, I don't need you to get a test for me to know that you are COVID positive, and we will count you as a COVID positive case. But if you have no known exposure and you develop symptoms compatible with COVID, yes, you should stay at home, get your test, and then stay at home until you get your test result back. So it's a little tricky. So we don't want people who don't know if they've been exposed, and if they have symptoms of COVID, yes, we want you to get tested. So get tested, then go home, wait for your result. And if your result is negative, then go about your business after your symptoms resolve. If your test is positive, then you need to stay at home for at least 10 days after your positive test, and at least symptom-free for 24 hours. All right, last comment here. Is it possible to be around someone with COVID-19 and not be susceptible to it? Yes, maybe. We're not sure. All those things that I have to say when we're still developing and still trying to interpret the science and still trying to collect science and data and process it as quickly as we possibly can. But CDC has come out and said that if you test positive for COVID, whether you have symptoms or not, you should not be tested again for at least 90 days. And during that 90-day period, if you are exposed to another COVID person, you do not have to quarantine. So that implies that there is some level of protective immunity for at least 90 days after a COVID positive test. But if you are unsure, then please isolate and quarantine according to the guidelines. All right, anything else on COVID right now? All right, we have a special treat today here at the Mobile County Health Department. We have some folks from the Scouts who operate the American Flag Retirement Flag Collection Program here, and they retire American flags with dignity and grace, and they're going to tell us about it.
BSA Troop 113 of Saraland, Alabama will conduct an American flag retirement ceremony on Saturday from 5 to 6 p.m. The drive-in event will take place at Saraland United Methodist Church. Individuals are invited to bring their American flag to be properly retired at this outdoor ceremony. They will be collected by Boy Scouts at the entrance to the church parking lot. Attendees can then tune their radio to listen to the ceremony. No one will need to get out of the car.
Make sure you get closer to the microphone.
I'm Allie Jacobs from Scout Troop 113 in Saraland. The Boy Scouts will also be passing out some Mobile County Health Department materials on COVID-19. So bring your old, faded, torn, or worn-out flags to us tomorrow in Saraland at 5 p.m. at Saraland United Methodist Church.
All right. Thank you guys. So remember, if you have retired flags, old flags, bring them to Saraland United Methodist Church tomorrow at 5 o'clock from 5 to 6. And the scouts will be there, and they'll be giving away some COVID information from the Mobile County Health Department. So thank you guys for that event, for doing this for us, and for you, and for everyone who has flags that they want to retire with dignity. So I'm Rendi Murphree. We'll be back to see you and talk to you on Monday about our COVID-19 outbreak. Thank you.